No. No, 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 no. Exactly.
You wouldn't put a bathtub in your bed.
You wouldn't put a slow cooker in your bed.
You wouldn't put a kayak in your bed.
You wouldn't put a fish in your bed.
You wouldn't put a ball pit in your bed.
So why would you crowd baby's sleep space with pillows, toys, and blankets? To sleep safely, babies need to be placed on their backs on a firm, flat, level surface that's free of clutter. Remember, keep it bare, keep it safe, keep it simple. Clear the crib.
Hey everybody, thank you so much for joining us. Welcome to August edition of our Cribs for Kids 25th Anniversary Safe Sleep Champion webinars. My name is Devin George. Oh, look, see, it's live. My name is Devin George. I'm trying to get to where I need to be on the screen. Thanks, everybody. My name is still Devin George. I'm the program officer here at Cribs for Kids. I am so happy to have company here today. Sitting on the chair next to me is Kelly James, our social media manager. She's in front of the camera for this month's webinar. And as always, Andrea Wilson, our multi-talented marketing officer, is running the show behind the scenes. As our guests are entering today, you'll see your mics are automatically muted and your cameras are off, so relax. We started the hour that you just saw with a video compilation of SIDS and Safe Sleep Awareness Month videos. Kelly did that. So fun, right? Photos, social media posts from the past few years. That's what we're talking about with our Safe Sleep Champions today. Making a plan to participate in October's SIDS and Safe Sleep Awareness Month. A bit about the webinars before we start. Today is the 7th, which you'd think I'd have this whole clicker thing right by then. Today is the 7th in our series of free 2023 monthly webinars marking Cribs for Kids 25th anniversary. All year long, around the 25th of each month, we talk with Safe Sleep Champions about the work they do to prevent infant deaths and injuries from unsafe sleep. Webinars are live, as you've seen, but they are recorded. So if you have a schedule conflict, or if you have to join late, or if you need to leave a little early, or better yet, you want to share a webinar with someone, you can do that. And if you do, you'll again be able to see easily that these are live. It's fun to look for the gaps that I regularly make. So the 25th anniversary page of our website is where you find all of the webinar info, past sessions, registration for next month, and save the dates for the rest of the year. So you head to cribsforkids.org, click on the About menu for our 25th anniversary link. And as you scroll through the webinar library, you'll see we've covered lots of ground this year, from what safe sleep is and what it looks like, to infant products, to research. Last month, we talked about the safe sleep challenges and resources that are available to support parents and caregivers in their safe sleep commitment. Dr. Sam Hankey, Amanda Simmons, and Katie Borzikas joined us last month to share their experiences and expertise. Had a little technical difficulty, and again, because it's recorded live, go see for yourself. A quick note about today, you'll see that both chat and Q&A are available. If you have comments at all, use chat for that. Andrea is keeping an eye on that. If you have questions for our guests, use the Q&A. We suggest you wait until we near the end of the hour, as we find that most of the questions that people have are answered during our conversation. But before we wrap up, we'll invite you to send your questions via that Q&A. If there's time, we'll answer them live. If not, we'll stay connected until after the webinar ends and we stop the recording and answer all of those for you right in that Q&A. So let's go. I'm going to introduce today's champions. I'll keep it short because we have lots to cover. Each of our guests does amazing work. You can read more about them on the bios that we have posted on our 25th anniversary website. Here's just a bit about them. Our first guest is Lorena Kaplan. Many of you may be familiar with her. Like Mike Goodstein, she is a champion among champions when it comes to safe sleep. Lorena leads the activities of the Safe to Sleep campaign, which is a public education campaign of the Eunice Kennedy Shriver National Institute of Child Health and Human Development, the NICHD. She drives national efforts to reduce safe sleep-related infant deaths by building strategic partnerships across the country, conducting tailored outreach projects, and coordinating multidisciplinary activities promoting the campaign's objectives. Reading her bio on her website, you'll find her work and experience in health promotion beyond safe sleep and the U.S. equally impressive. Next, we welcome two team members from U.S. News and World Report, top-ranked and Safe Sleep certified Boston Children's Hospital. Jennifer Gingrasfield, and I'll give her a chance to correct my pronunciation of that when we talk with her, and Sara Drumm. Jennifer is a pediatric nurse practitioner with the Sleep Center at Boston Children's Hospital. Practicing for over 15 years, Jennifer also founded the Infant Safe Sleep Subject Matter Expert Committee at the hospital, where she leads more than 100 multidisciplinary members to establish consistent practice and promotion of safe sleep across the care continuum. Among her many professional memberships, she counts the International Society for the Study and Prevention of Perinatal and Infant Death, ISPID, where we also get to work together. Jennifer is joined by her colleague, Sara Drumm. A nurse for 40 years, Sara has been bedside in the NICU at Boston Children's Hospital since relocating to the US from Australia in 1991. Her accent is lovely, unlike this Pittsburgh one you're hearing now. Sara's passion for safe sleep was ignited when she joined Massachusetts NICU Safe Sleep Initiative as part of the state's very successful Neonatal Quality Improvement Collaborative. You can read about that on our website too. Sara works with Jennifer to expand safe sleep across the hospital, co-chairing the Safe Sleep Subject Matter Expert Committee with her. And she also leads the hospital's ongoing safe sleep certification efforts. And finally, we welcome Roberta Hawthrone, a public health specialist serving the Piedmont region of North Carolina. With a focus on equitable access to information and education, Roberta has used her language education and training to advocate for adults and children alike. She currently serves as Health Education Manager and Public Information Officer for the Rockingham County Division of Public Health in Wentworth, North Carolina. But we're going to talk with her about her work as a public health educator for the Forsyth County Department of Public Health in Winston-Salem. Among other things, she was the coordinator of the county's Infant Mortality Reduction Coalition. During her tenure, she developed a unique and really fun way to educate her community about infant safe sleep. We can't wait to hear her share that with you. So with 4 guests, I'm going to turn it over to Kelly and Lorena. Lorena's going to turn on our camera and turn on her mic, and I'm going to pass this over to Kelly.
Thank you. Lorena, I'm so happy to be with you here today. Welcome. We have a lot to talk about with Clear the Crib campaign and plans for this October's SIDS and Safe Sleep Awareness Month. Cribs for Kids and the NICHD have been working together for a while on this annual event. It was our National Safe Sleep Conference in 2019 when you first talked about the Safe Sleep SNAP campaign, and I was so excited to hear you talk about it. And here we are in 2023 with the Clear the Crib campaign. First, share with everyone when this October Awareness Month campaign started and its objectives.
Sure. Well, and thank you again for having me. It is a pleasure to be here with you and everyone who's joining us. Well, SIDS Awareness Month as a national observance has been around for decades, but our coordinated effort among federal agencies and national organizations started around 2018 when we decided to, as a group, address the needs for better resources at the national and local level to address safe infant sleep education. So the overarching goal was to raise awareness about what safe infant sleep looks like, and also for us to provide easy to use resources that could be tailored for outreach at the local and state level.
Nationally, this is referred to as SIDS Awareness Month, but the overall message definitely focuses on safe sleep. Why is that?
That's a great question. So in 1992, following the American Academy of Pediatrics recommendation to place babies to sleep on their back to reduce the risk of SIDS, the field started focusing on that as a key practice for parents to keep babies safe while they sleep. But equally important has always been knowing how to create and maintain a safe sleep environment. So this activity really tries to do both. Educate folks about ways to reduce the risk of SIDS, but also all sleep-related causes of infant death, including, for example, accidental suffocation and strangulation in bed.
Mm-hmm. Since it started, the approach to the awareness activities has evolved. I mentioned Safe Sleep Snap earlier, and we saw it in the video at the beginning. Can you talk about that? Maybe not everybody watching knows about that campaign and how that started and how it works, along with the new Clear the Crib campaign.
Sure. So first of all, who doesn't like seeing adorable pictures of babies? But in 2018, when we first started planning this coordinated effort, we looked to the peer-reviewed literature to help us identify priorities to address. And what we found was that images of unsafe sleep environment were prevalent across all media channels. And that while parents and caregivers were seeing and consuming these images of cluttered sleep environments, at the same time, they were probably also establishing some social norms that could lead to some really tricky situations for babies. So our aim was to counteract this inaccurate messaging, visual messaging, by infusing our own images of safe sleep environments, specifically on social media, because we know that this is a place where folks now go to get not only entertaining updates about what their friends and family are doing, but also medical information about childcare practices, and any other number of health behaviors. So it was our attempt to make images of safe sleep environment more normal.
It's a genius campaign, truthfully. The evolution, as you said, is rooted in social media, both using not only its ubiquity and economies, but also how it works when it comes to education and behavior change. In July, your team hosted a webinar to launch planning for the month. During that session, you talked a little bit about this. Can you tell our audience about it?
Absolutely, yes. So again, going back to 2018, when we went to the peer-reviewed literature, we wanted to make sure that whatever we offered next for the field was grounded in fact and science. So we looked to establish behavior change theories, as well as a variety of published studies. What we learned was that, as I mentioned earlier, across the board, infant sleep environments in the media often include unsafe elements, and that can look like soft bedding, toys, or any other number of clutter items in that space. Media exposure to health messages and images influences consumers' knowledge, their attitudes, and their practices on safe infant sleep. And that social media, as a primary way that people communicate these days, does contribute to the adoption and normalization of these attitudes and behaviors. And when we check that against established behavior change models, all of this tracks. We know that in order for us to attempt to influence someone's behavior, we need to impact their attitudes, meaning their belief that the recommended behavior will actually create a desired outcome. Their subjective norms, that means that the people in their environment, be it their family, their community, and that can be in-person community or social media community, believes and supports the recommended behavior, and also that the individual believes they have the skills to actually perform that behavior. And any of these constructs can really impact the other. So that's where individuals at the local level, Safe Sleep champions, can really impact somebody's intention to practice a recommended behavior. And that's why we are so grateful that everyone who's joining us today cares about these issues and is doing outreach to help keep babies safe while they sleep.
Absolutely. This year, like last year, it's all about the crib. The only place babies should be sleeping ever, a crib, a bassinet, or a play yard. Just as important is that it only be baby in there, just baby, just like our lullaby says. Baby and a pacifier. That's hashtag clear the crib. What is this challenge exactly? We saw some videos at the start of the hour, but give us some more details.
Right. So one of the videos that you saw was our attempt at a gamified learning experience. I mean, who doesn't love a little friendly competition? And these days, it didn't happen if we didn't post it, right? So we're encouraging folks to learn about safe infant sleep, to understand that it doesn't need to be a sad or boring experience to learn about this very important topic. And so we created, with your help, the Clear the Crib challenge. And it's very simple to set up if you're in a learning environment, let's say a classroom, which can mean a childbirth education setting, or if you're having a baby shower, or if you're in your OB's office or pediatrician's office. If you have the space, you can set up a, let's say, portable play yard and add up to 10 pieces of what we're calling crib clutter. That can be blankets and pillows and bumpers. By the way, all of these items do not belong in baby sleep environments. I want to make that clear. We've created game instructions that are available on our website, as well as other supporting resources to launch the challenge. And once the space is set up, once your participants understand what they're supposed to do, you give them 10 seconds to clear the crib. That means remove all the items that don't belong and leave those that do. If you're using a doll to, take the place of the baby, then the doll would stay, and potentially a pacifier. And by the way, pacifiers do help to reduce the risk of SIDS, but the AAP recommends that they only be used after breastfeeding is well established. So once all the items are removed, you count the number of correct items that were left in the space and then celebrate whoever won the challenge. And as we've already seen, this is something that can be used as a friendly competition. So you can have it be a relay race. You can have it just do one participant at a time. There's champion certificates. There's participant certificates. So a variety of things for providers at the local and state level to make this their own and to make it as fun as it can be for different learning environments.
It is so fun and so simple to participate and promote the message. I mean, if you have a phone and you have access to a social media platform, you're good to go, right? I mean, how does it work?
Well, so if you're somebody who likes to be active on social media, it's as simple as point, record, and post. So this doesn't need to be a highly stylized challenge, if you will. All you need to do is really pull out whatever phone you have, record somebody doing the challenge, which can be yourself, and then post it on whatever social media channel you prefer. Use the Clear the Crib hashtag and share it with your network. Start a conversation about what safe infant sleep looks like. And also, this is a way to give folks an opportunity to learn that babies don't need a lot of stuff in their crib to be safe. In fact, the less stuff that's in there, the better. Simple really is the way to go.
Absolutely. Easy and fun. Boston Children's is going to talk about their Clear the Crib experience in a little bit. But at last year's campaign, we saw not just hospitals, but also daycare centers, families, WIC, and other agency offices joining in. Anyone can do this, right?
Absolutely, anyone can. And in fact, we encourage a variety of different, what we're calling influencers, to get involved. So if you recall that behavior change model that we looked at talks about those social norms. So it's important that parents and caregivers be supported to practice safe infant sleep, not only by their partner, but also by their health and service providers, by their neighbors, by the babysitter, by grandparents. It is so important that the community as a whole get involved in keeping babies safe while they sleep.
You and your team offer so much, all at no cost, to both participate in Clear the Crib and to provide safe sleep education. Where can we find information on Clear the Crib?
Well, if you go to our website, which we're showing now, you can find a wide variety of resources that we've assembled specifically for SIDS Awareness Month. And while we're the ones to host and collect this information, I want to emphasize that all of these are products of group work. The SIDS Awareness Month planning team, which includes Cribs for Kids, has been working hard for several years to reimagine what each year's focus is going to be and how we can do a better job of serving the needs of our safe sleep champions at the state and local level. So through this toolkit, you can learn more about the Clear the Crib Challenge, where you can find a variety of resources. We have, for example, sample responses. Should you see somebody interacting with you on social media who doesn't necessarily have a full or accurate understanding of what safe sleep looks like, we've provided sample responses that are respectful, but also educational, and links to our partners' pages so that they can learn even more about all the wonderful resources that are out there that we're calling plug and play. We understand that at the state and local level, folks don't always have a ton of resources to dedicate to creating things just for October. So we've taken on that role and hopefully provided some useful things for people to tailor.
So great. When people go to the Safe to Sleep page, they'll also be able to click through to some new elements on the website, like the interactive room and education pieces, we all had to make updates reflecting the updated 2022 recommendations. How can people access those?
So again, all of it is free, and you just go to our website. That specific tool that we just looked at was the Safe Sleep Interactive Room. And to speak specifically about this one, for example, we know that folks learn in a variety of different ways. And especially now with younger parents experiencing a disproportionate number of sleep-related infant deaths, we want to make our education more engaging. So this is a room that takes you through different elements of what you might have in a typical bedroom, and also the recommendations from the American Academy of Pediatrics. So this one, for example, is about practicing tummy time, and to make sure that while baby is on the floor, strengthening those neck and arm muscles, that their caregiver is fully awake and watching. And we go through a number of other recommendations, for example, what it would look like to bring baby to bed to feed or comfort, while also removing all the soft bedding from that adult bed to reduce the risk of suffocation or strangulation in bed.
Wonderful. Lorena, thank you so much for being so gracious with your time. We appreciate you joining us for the rest of the hour. We heard from Lorena about the Clear the Crib, and we saw some videos from last year and some of the posts. Now we're going to talk with a hospital that had some fun with Clear the Crib last year. We'll hear about what's on deck for this year. I'll pass it back to Devin.
Thank you. Mouth swap. Thanks so much, Lorena and Kelly. I really love having the company for this one too. And thanks for taking the time to join us, everybody. The safe sleep care given at Boston Children's Hospital is exceptional. We have two folks joining us from their team now. Jennifer, who I introduced earlier. Jennifer, how'd I do on your last name?
Pretty good.
Pretty good. Well, now's your chance to get it right?
Gingrasfield.
Gingrasfield. Oh, sorry about that. So, and here is Sara Drumm joining us as well. Thank you so much. So again, as I said, the safe care that you all provide at Boston Children's Hospital is exceptional. That's no surprise. U.S. News and World Report consistently ranks Boston Children's among the best children's hospitals in the country. And you guys have embraced safe sleep just like you do everything else. So Jennifer, I know what your team is up to, but can you share it with everybody on the call today?
Yeah, thank you so much for having us. We have been hard at work for a while now to promote safe sleep at Boston Children's, starting with the 2016 AAP guidelines that came out. A small group formed and launched a safe sleep initiative. And there's quite a bit of background work. And the full-fledged safe sleep guideline was actually officially launched in early 2020 at our hospital.
And yours is a fairly large hospital, right? So a hospital-wide safe sleep commitment isn't an easy goal to set or to meet. So what did it look like working with something so large?
Yes, we are a big hospital, and we have about 15 separate inpatient units that care for infants. So to get to that point of the early 2020 launch, we needed to garner support from physician and nurse leadership. We brought in a hospital sleep SAC program. We established a formal guideline. We developed and delivered large educational campaigns via web-based methods, as well as in-person staff trainings, and engaged our marketing team's support as well to come up with things like posters and screensavers that run. And our group was officially designated by the hospital as a subject matter expert committee in July of 2020, so pretty shortly thereafter. And that was really fantastic because it recognizes the importance and the ongoing nature of the work of infant safe sleep and the quality improvement initiatives that we perform. So this SME, like you said, reflects a really large multidisciplinary team. We have, over 100 members, and they're made up of a variety of folks from inpatient and outpatient areas. Just for some examples, a lot of bedside nurses, child life specialists, physical therapists, specialty providers from areas like general pediatrics, sleep medicine, neurodevelopmental psychology, injury prevention, and that's just naming a few.
That is a lot of heavy lifting. we can't even get people to decide a restaurant to go to for dinner in our family. So I can't imagine getting all of these multidisciplinary folks who care in so many different ways for these babies. So thanks to all of those good works, your hospital earned its Silver Safe Sleep certification in 2022. So that's a couple years in the making. Okay.
Yes, excuse me. Sorry.
Tis the season, right? So thank you for that good work that you guys do. So in true Boston Children's fashion, that's not the end. Your hospital is working towards gold certification. That means you're adding two things from your silver to go to gold. One of those is adding the assessment of safe sleep space and providing one to the families who are identified in need. And that's been launched, right, Jennifer?
Yep, that's right. So just last fall, we started exploring that opportunity. And this summer, we received a JPMMA micro grant to help support the initiative that we've started calling Safe Sleep at Home. And again, had to garner support from hospital leadership, which we did, which is fantastic. And now, starting in early September, we're going to begin screening all admitted infants to ensure they have a safe sleep space available to them at home. And then if they don't, they'll receive a social work consult, and we'll provide them with a crib bundle. So that's going to be the portable crib, fitted sheet, and a sleep sack, coming soon.
Yeah, that's congratulations on that JPMO micro grant. I saw the post on social media, and that's what we have up here now that people are seeing. And upgrading to gold also includes community outreach. And that means that you are teaching people about infant safe sleep who aren't going to get that education bedside. So one of the things the hospital has historically done for this is a lobby display for safe sleep. But Sara, you guys really expanded on that last year with the Clear the Crib, right?
That's right. We did, Devon. So we had the previous year in 2021, we'd had a lobby display, which was one thing that we were able to do was have sleep sacks for giveaways. But we noticed in that initial display that the table wasn't, not a lot of those sleep sacks were given away. I don't think the attendance was that high at the table that year. So when it came to planning for last year, we were brainstorming ways that we could increase our visibility and get more people involved. And that's when we came across the Safe to Sleep program's Clear the Crib Challenge. So we decided to incorporate that. And it was an absolute resounding success. We had so many visitors come by and take advantage and receive the education that we wanted to share. We ran out of sleep sacks, in fact, early, and we had, I think, around 200. So that was just great, and it was really well received. So, yeah, we were thrilled to be able to incorporate that last year.
So how did you expand the display then from year over year?
Yeah, so like I said, the previous year we had just had the table with the educational material, and we would review that with the people that came through the lobby. So this past year, what we did, as you can see in this picture, we had a large crib, and we made some really big eye-catching signs that we could get people's attention with. I worked with my awesome Safe Sleep SME committee member, Madeline Cusger, and we secured space in the lobby that had the highest visibility, because we want that. It's actually, it's great because we have a captive audience in the lobby at Boston Children's. As Jen said, it's a very, very busy institution. So there's traffic coming through all day long, many, many people. So there can often be 2 or 3 tables of some sort of display, but Madeline and I were like, nope, we want the middle front space to get all of the attention. So so what we did prior to the beginning of the month, we promoted the event internally on our internal web. We let people know that there would be safe sleep sack giveaways for coming and participating in the challenge. We had postings on other internal sites within the institution. And then within the lobby, like I said, we had these really large signs, and we actively got out there as people were walking by. We flagged them down and said, come and have a go at our Clear the Crib challenge. And so that worked great. We were just so well received.
That's great. So you promoted it internally. You worked with injury prevention, I understand. You promoted it to your staff. You had the prizes, like carnival barkers. It sounds like you were out there keeping people from who might just walk on by to come in and do that. And so who all were you able to connect with in the lobby space then?
Yeah, so we were surprised, really. Of course, many people from our units came as we expected, where we had promoted it internally. And of course, then all the patients and families walking through the lobby. But then we had a lot of staff members coming as well. Physicians, nurse practitioners, our environmental services people, like people from across the board who are employees of Boston Children's Hospital. So we were able to spread the word to so many different people. And we were really surprised by some of the responses that we received. We had some physicians who came. I remember one particular dad who, or dad to be, who came and did our challenge and left saying, well, my wife doesn't know any of this, so I'll be going home and teaching her all of this. So, you know, it was great to see how many people we reached and the impact that I think we really did have. The other thing, we did have some people come and share their stories of losing infants or loved ones to sudden unexplained infant death. And I think that just reinforced the importance of what it was that we were doing as well.
Yeah, always. And it's horrible to hear those stories, horrible, but important that people who do suffer those losses share that so that we continue to promote this education. So as you heard from those parents, and you mentioned you heard from kids and grandparents and employees around the hospital, as you mentioned, even the docs and the staff taking the information home, and that you ran out of sleep sacks. So that's all great. You also mentioned when we talked earlier, being surprised by how much the employees and docs engaged in Clear the Crib, but you also mentioned a couple of other unexpected benefits.
Yes, right? Definitely. One thing that I not expecting or hadn't even thought about is because of the visual nature of this kind of activity. You know, we have people from all over the world coming into Boston Children's, and it really was able to overcome language barriers. You know, people could just come see what it is that we were doing. We were able to explain it visually, and people could participate and I think take home that education with them, regardless of whether English may not be their first language. So I thought that was really beneficial. And then the other thing is a lot of the staff that did come by and that heard about this challenge internally as we promoted it, took that back to their own units, and had these did these Clear the Crib challenges on their own units, which we still continue to do, by the way. It's just such a fantastic tool, so easy to do. We're excited to have our new Sasha and Sammy, who I know you're going to talk about shortly. So easier to do that, more easier than ever on our unit now. So yeah, it's just been fantastic, and we can't wait for October 23.
So, and we know that you guys do, your hospital does outreach all through the year, but October is a special time. So Jennifer, what do you guys have on deck this year? As Sara mentioned, October 2023.
Yeah, so like she said, last year was so well received. We ran out of our giveaways, and we plan to host very similar initiatives this year with similar lobby events, and we'll be promoting that internally as well, just like we did last year. Additionally, we will do weekly internal web postings of a particular topic. So perhaps just an announcement about Safe Sleep Month and come down to the lobby, but also on special topics like the danger of nursing pillows during sleep. We will be doing Clear the Crib challenges in individual units, like Sara just mentioned as well. And then really special this year, a group of our sleep laboratory technologists are actually organizing a fundraiser to raise money for this new initiative, the Safe Sleep at Home program that I mentioned earlier.
Wow, that is great. That is a lot. It's a lot. It should be a great month, right?
Yeah.
So we will look for some posts and photos from you guys as the month progresses. And more importantly, we'll be looking for that gold upgrade application, thanks to the work that you're doing with the JPMA grant and your continued outreach. That's all just such great stuff. and it's hospitals, community agencies, and more can all share the safe sleep message in October in lots of ways. And you all talked about how going from the lobby took it out into the community, but up into the units and across all of the hospital. And other agencies can do the same thing in lots of ways, using Clear the Crib, not necessarily in a lobby, but at a community event, joining our Breath of Life stroll, contacting your local media to air PSAs or feature safe sleep demonstrations on their news programs. We've all got lots of free content to use for that. And news programs are always looking for content. So maybe those news agencies might even do a Clear the Crib right on the air. The important thing is to plan something for October, just like we heard Jennifer and Sara doing for their hospital. October is our SIDS and Safe Sleep Awareness Month. And we're asking people to do that just the same way that Roberta Hawthrone did. And we're going to talk about her unique outreach. I'm going to hand it over to Kelly and Roberta. And let's see, right? Yes, there you go.
Thank you.
I feel like I should be doing something else. I'm not sure what that is, but beyond just handing you the mouse.
Roberta, thank you. It's so nice to see you today. Before we talk about your creative approach to SIDS awareness and Safe Sleep Month, in case everybody hasn't met them already, let me introduce Safe Sleep, Sammy and Sasha. I'm actually going to hold them because I love them so much. Come on down.
So much.
Our babies.
I feel badly I didn't introduce them earlier at the start.
I know, they are stars.
My apologies.
Sammy and Sasha each come with a toy-sized replica of our cribette and carrying case. It folds up just like our full-size cribette. They've got pacifiers, come with safe sleep education, even a little snapette onesie and a little snoozette wearable blanket. Just completely adorable. We originally designed this product as a sibling gift, encouraging little girls and boys to join in safe sleep care of the babies and their families. But our innovative partners quickly realized Sammy and Sasha were great for education. They're so portable, great for demonstrations, and especially helpful for teaching with language barriers. Turns out Sammy and Sasha are great for social media too. Whether doing demonstrations like this transfer post from the evidence-based Safe Sleep Facebook group, or going to events, like here they were in North Carolina last year, or their own campaign. Roberta, that's exactly what you did. You used Sammy and Sasha as the centerpiece of a social media campaign for Forsyth County Health Department. Where did that idea come from?
So it all started in 2021. Of course, we were working under a lot of COVID restrictions, and we couldn't really go out and do community education about safe sleep the way we typically would. And we also needed a break from using our social media pages as a place to dump COVID data. So we were looking for something fun and engaging. So we started using Sasha to do some little posts like this, and we took her around and set her up in displays at community locations that we thought our local residents would recognize. And it gave us something kind of fun. It was something quick and cute that could be shared on social media so that we were still getting our community thinking about safe sleep.
We saw those posts and shared them. I was thrilled when I saw them. What a fun way to promote safe sleep. And this first year was well received. So what did you do last year?
That's right. So for 2022, we decided to really expand the campaign. We brought in Sammy as a companion for Sasha, and we also started incorporating more materials and posts in Spanish as well.
Here they are. You really did plan a whole month with them.
That's right. So we had Sasha kind of kick off the month as she kind of came back into the spotlight for the month of October. We also had her be the one to introduce Sammy to all of our followers. And we tried to dive in more deeply to some of the AAP safe sleep recommendations. But we also tried to keep some of that very local flavor to the post and used recognizable locations. So like here you can see the girls hanging out on the Forsyth County sign. That's in the lobby of the health department building. So when we put up posts like that, it was really easy for people to go, hey, I know that place, and get more excited about engaging with the post.
You did such a great job taking them places that, as you said, related to the AAP's safe sleep recommendations, not just the ABCs of safe sleep, which are so important, but others. We're going to share some of the many posts from across the month. They were creative, engaging, educational. You were able to promote the importance of not sharing a space, not smoking, following vaccine schedule, and breastfeeding. And how was the response online?
So the response online was overwhelmingly positive. People really liked that these were cute posts that they could share and engage with. And we also got really good feedback from our community partners who let us set up displays and take photos in their spaces or with their staff because they liked that they were being tagged, they were getting involved, and people were just knowing that they were involved in this campaign.
Oh my gosh, so cute. As the post went on, did you get feedback when you were out and about with them?
Absolutely. So one of my favorite parts about working on this campaign was when we took Sasha with us to a community fair and we had her set up in her little crib on our table. And a community member actually came up to us and looked at Sasha and said, "This is Sasha from Facebook." So that's when we knew the campaign had really been effective. She was becoming an influencer. She was someone that community members were recognizing and were excited when they got to see her in real life.
Oh my gosh, they really became social media influencers through your work. I love it. We know you aren't working with Forsyth County any longer, but we do have someone from the county on the webinar. Yolanda is available for any questions and answers at the end if anybody would like to learn what her team is doing for the month, or you could visit the county's website. Roberta, you are continuing your safe sleep work in Rockingham County. Tell us about that.
That's right. So we're excited right now because we have recently applied for a mini grant through the North Carolina Public Health Association. If we are awarded those funds, it would give us a chance to start up a Cribs for Kids program here in Rockingham County so that we can provide safe sleep spaces for families in need and, of course, do more education using Sasha and Sammy.
Oh, that's so great. Congratulations.
Thank you.
Thank you so much for making my social media role at Cribs for Kids more interesting with your Sasha and Sammy ingenuity. And best of luck on your new project.
Thank
we
you.
hope to hear more about that as it progresses. Thanks to all of our Safe Sleep champions today. I'm going to pass it back over to Devin, who will wrap up the hour.
Yeah, I do want to point out, as we talk about infant safe sleep in October, it doesn't have to be a big giant plan, right? You heard at Boston Children's, while their safe sleep education or their certification was a large project, having something like that lobby display really just resonated throughout the hospital and outside into the community, and people took that message out. And you hear Lorena talk about that social media and how important that is. So you see somebody like Roberta, who started with some pretty, simple, easy to do posts, and how that just expanded so that people were recognizing Sammy and Sasha out in the community and took that forward into 2022 and expanding that effort. And that really is the whole idea of it, right? You tell somebody and they tell somebody and they tell somebody. So,
exactly.
We hope that you can take a small step forward. So I do want to just, address that it can be the smallest of efforts, right? And I love that Sammy and Sasha are doing some work here at Cribs for Kids too. Get to it, babies. And remembering that imitation is the greatest of flattery. Maybe some people on this webinar will see something like this and go ahead and do something similar this October as well. And I hope you all who are watching enjoy hearing about the work that people are doing for infant safe sleep. And again, seeing that impact that it has across their communities. It's our partners and advocates who we want to thank that take the mission across the country. Because we're just, we're here in Pittsburgh spreading the message, but it only works if everybody else does that as well. Lorena, Sara, Jennifer, and Roberta, thank you so much for joining us today and sticking around for questions. If you do have a question, now is the time to go ahead and put that in the Q&A. We'll keep an eye on that. Sara and Jennifer and Roberta and Lorena are going to turn their cameras back on, but keep themselves muted so that you know they're really actually here should you have any questions. So while you're getting started on those questions, we're going to go to our closing items. As we end each webinar, if you've been here before, you know we do three things. We do a call to action, we open up registration for our next webinar, and then we also feature our new lullaby, Just Baby. So first, our action item. If you haven't, can you guess what it might be? Plan your participation for October SIDS and Safe Sleep Awareness Month. We learned today there are lots of ways to do this. Join us for the Clear the Crib Challenge with your colleagues and clients. Take the month to post your own or share safe sleep posts and images on social media, just following other advocates such as us. October is the perfect time to revisit our earlier action items. So if you haven't done so already, complete our updated Safe Sleep Ambassador module. Open your October meetings with our Just Baby Safe Sleep Lullaby, right? It's there, it's available for free. You heard the music bed playing underneath the slideshow in the beginning, and you'll hear the lullaby at the end. Go ahead and use that. Sign up for product recalls, connect people with the safe sleep support resources that we talked about in July's webinar, right? So if you heard Sam and Amanda and Katie speak last month, you know that there are great places to go to for on-demand free safe sleep support. Maybe you might even consider submitting an abstract for our May 2024 conference, the work that, for example, Boston Children's Hospital has done, and Roberta actually presented last year in the conference. So if you're doing things, please share them with us. And that's a great time to do that is at our May conference. Abstracts are due by the end of November. So with hashtag Clear the Crib as its foundation, October is our month to really shine a light on SIDS and infant safe sleep, because that safe sleep is the only way that we know how to prevent SIDS and the deaths of thousands of babies each year. So that's our action item, 1, done. Next is registration for next month's webinar. That webinar at the end of September is going to be right on the heels of starting October. So we are super excited about what we're able to offer our safe sleep supporters and advocates for September's webinar. We're going to kick off SIDS and Safe Sleep Awareness Month with that webinar, and it's a safe sleep expert roundtable. It's scheduled for Tuesday, September 26th at noon Eastern. And when I say experts, I really mean the experts. Cribs for Kids is honored to welcome members of the AAP Task Force on SIDS and the authors of the updated 2022 recommendations for reducing infant deaths in the sleep environment. Truly the expert. Task Force member Dr. Mike Goodstein will moderate the roundtable. He'll be joined by his colleagues, Drs. Jeffrey Colvin, Susan Wang, and Rebecca Carlin. And Dr. Carlin is the lead author of the 2022 recommendations. It's an interactive hour, and it's going to give you a great opportunity to present your questions to the docs who write the recommendations, the recommendations upon which all of us build our training, education, and our programs. So this is your chance. If you have but why this and not that? And what do I say in this case? Or where is the information coming from for this recommendation? They're going to be right there, and you can ask that question. So to facilitate that conversation, did you get that word that I said? Facilitate that conversation.
Big one.
When you register for the September 26th session, there's actually going to be a field where you can submit your question in advance. So that will help them to prepare and help us to understand what topics might come up, but also get everybody thinking about what questions do you want to ask these doctors who wrote these recommendations when you're here and have access to them. We hope you'll be able to join us and that you will be as excited as we are for this opportunity for discussion and exchange. That's the idea with these safe sleep experts. Okay, so the action item, the next webinar, and now our lullaby. Like the Safe Sleep Ambassador and our video library content, it's available online at no cost. The song, as I mentioned, the video, the music bed, there's an English and a Spanish version. Kelly has done some fabulous and fun videos that go along with that webinar, so that's all there. Andrea is going to play the webinar, and we'll stay on and take a look at those Q&As. So if you've got about 5 minutes to go ahead and put all those Q&As in, we'll stay tight here. And again, thank you so much for joining us. Remember, you can always reach us at info@cribsforkids.org. Thank you so much.